in developing countries, we have encountered so many young age breast cancer patients. So comparing to the Western countries, in our country we had around 5 to 7% of younger age patients, which is younger than 40 years old or 35 years old. And especially in our cancer center, recently we have facing that around 14 to 15% of younger age breast cancer patients. I think we need a special treatment for those patients, and because they are very young, they are facing their working, and they're considering about fertility and some psychosocial pressures according to the disease. So we find some very interesting and important results from the systemic treatment for those patients, and it's improving the survival benefit for those patients. So as a surgeon, we should combine all these surgical strategies with the systemic treatment. So what I gave the topic about young age breast cancer patients, I will focus on these issues. Well, immunotherapy it's still on the trials for breast cancer patients, especially for those triple negative patients and for those some HER2 positive breast cancer patients. We are looking forward to see many important improvings of these results from the trials. Of course, not only HER2 positive, but also hormonal receptor positive patients. We had seen very huge improvements for these targeting therapies, even without chemotherapy agents. Those targeting therapy can help a lot to improving the survival rate or the progression-free survival time. Of course, we see lots of patients and especially younger patients. They are seeking for breast conserving surgery in our country, in my city, and the breast conserving rate is increasing rapidly in our center, and also the breast reconstruction, especially those immediate reconstruction for those patients. And I think we still had unmet needs from our society, because breast surgeon is a new area, it's a new subspecialty in our country, and many surgeons are from general surgeons. They're lacking of pre-training course for the oncoplastic or plastic surgeries. So I think to improve the surgical quality and the standard for these patients, we need to have a more training course or training centers for our society to do more for our patients. Yes. I just sat beside Professor Ricardo. He's from Liverpool University, and he's a very experienced surgeon. And he also mentioned in the UK, also in other European countries, they are trying to set up kind of a standard training course for young specialties, especially breast surgeons, and they provide some grants to support this kind of training. And in my experience, that because I'm at the beginning of the residency, I'm a thoracic surgeon, and we do thoracic surgery and breast surgery together. And it's very common that young surgeons had been training in a general surgery background, and then they will move to breast surgery specialty. And I think it should take about 1 or 2 years in this specialty, and take some round in the plastic surgery department, And also we need invite several very experienced surgeons to give a live surgery training course for senior young surgeons. And we try to set up several training centers in China, in mainland China, to recruit and to prepare and provide several chances every year for local surgeons. And because China is very big, and I think it's very important to provide several centers across the country. I think this is a very successful meeting to help us to meet many specialties and experienced speakers from all over the world. And I think we have very good friends. I know, like Dr. Omar Yusuf and before, and I know several very experienced surgeons. And we can exchange our experiences. And I think we had a conclusion that breast surgery is a very unique surgical oncology branch, and we need to do something to facilitate all these trainings and to promote the standard of the breast surgery for our patients.